Thank you for listening to this recording of our newest rescue dog named Trixie. Trixie is a 13-year-old female Shih Tzu recently rescued from a Maryland shelter where she was surrendered by her previous owner. We took Trixie into our rescue and immediately took her to our vet because we noticed her eyes were infected. We also noticed another condition called dry eye. She was tested with the smear test, and it's a tear test. And the tear test can give you a value of 0 to 15 and above. And we found that on that scale, where 15 is eyes that are producing enough tears, Trixie rated 0. That means she has very little tear production, and it is critical that she's giving medicated eye drops called cyclosporin or tacrolimus. Right now we have her on a cyclosporin drop 3 times a day. And in between the eye drops, we give her an over-the-counter drug called Genteel, and it's just an added extra lubricating drop. We just kind of throughout the day give her eye drops. One of the things we do, and as recommended, is that if you're going to put her up on a table, put a fluffy towel there so she's comfortable. You can have a direct vision of the eyes so you can see clearly. If you need to clean anything around the eyes, we will provide you with a saline solution. We don't recommend water because water has impurities, and when you're cleaning the eyes, you want a sterile environment. So the saline solution with a little bit of a soft cotton, cleaning around any crud around the eyes just to keep the eyes clear of debris. And from there, you can put the eye drops in. And afterwards, we recommend having a high-value treat like cut-up cheese, hot dogs, to present to Trixie after the procedure, just so she associates that procedure with something yummy. She does like her hot dogs and cheese, and I think she will like the whole experience better if she was getting a treat afterwards. As far as her eye care, it's a very simple process, but again, it's very important because we don't want her to be uncomfortable. Again, the dry eye condition is like sandpaper rubbing against the cornea, and most often when we get dogs with this condition, a lot of them are dry because the owners just don't realize without care the dogs do go blind. She does get around. She's a very quiet, low energy dog to begin with. So she's house trained. So frequent, breaks outside throughout the day is enough for her as far as giving her attention. She'll just love you to death. As far as her house training, no accidents. She would be great with anybody, but we do ask that the environment that she goes to be very quiet and easygoing because she is fearful of other dogs. We don't feel that Trixie was in a home with other dogs. We feel that she probably was alone. And for that reason, with her limited eyesight, we want to make the environment very stress-free on her. It's like us going through a stressful situation. We want to present ourselves with a stress-free environment if we can. And we want to do that with our rescue dogs. So we're hoping to find a foster without any other dogs and someone possibly home part of the day just to give her breaks. With that said, she is a little bit timid of new experiences because, again, this is a transitional phase that she's going through. So anywhere she goes, we're going to be providing you with anything you need as far as any of her behavioral needs. She's a low maintenance dog, but she is a little bit timid. We found that even with that, she has a little bit less of an appetite. She's a little bit more finicky, and when she does eat, she eats great. She's not the type of dog you can throw a bowl of kibble down and just say, here, if you eat, you eat. If you don't, you don't. It's very important to our rescue that our dogs are getting the nutritional needs they need. And if that's the case, if she's not eating, we need to find out what we can do to help her be more motivated to eat. So to help Trixie feel more motivated to eat, we've implemented more home-cooked foods into her diet. And it's very similar to a high-quality canned food, but as far as cost, it's easy enough just to add a little bit of the home-cooked foods to her diet just to make her more motivated to eat. And one of the examples is of this particular home-cooked diet. It's very simple that we've made, and we can provide to anyone fostering just to get her through a transitional phase. Once she's more comfortable in the home setting after a couple weeks, we anticipate that her eating will increase. But at the very beginning, it's very important to make sure that she is eating throughout the day, and we're adding higher end foods to the diet to encourage her to eat more, whether it's a home cooked meal that we provide to you or simply a can of chicken and water added to her dry. We will make sure it's provided to you. Right now she's on a dehydrated origin base, and on top of it we're adding home cooked diet, and she's doing fine. I don't think she's the type of dog, though, that's just going to eat a bowl of kibble and be fine with it. Not at this stage, at least. So we need you to be very much in touch with us on her eating status. Again, we do not want her to go any days without food, especially if there's something we can do about it. Other than that, those are the core things that we're seeing in her care. Again, her eye treatment is very important. We want to make sure she's eating properly, and we want to make sure she's relaxed and stress-free. It sounds like it could be a lot, but it's really not once you start getting into the rhythm and routine of her care. We just want to make sure that she's comfortable, and we will also offer any help for anything else that may come up, because again, she is new to our rescue, so this is basically all we know so far. Please consider fostering this little girl. She is a darling little girl. She deserves a chance, and we want to make sure we provide the best environment for her, and we feel a home without other dogs would be perfect. So again, please contact us as soon as you can, and we'd love to talk to you more. Thanks so much.